Hey guys, it's George here, and today I'm going to be covering the coxofemoral joint. This joint is located superior to the knee and lateral to the coccyx, which we can see right here. It connects to the pelvic girdle to the lower limb and is designed for stability and weight bearing as it takes the weight of the trunk and it provides mobility to the lower extremities. So the head of the femur articulates to the acetabulum, and the acetabulum is actually composed of the pubis, ischium, and ilium, and it creates this concave sort of shape that connects to this hemispherical shape of the head of the femur. So this articulation allows for the support of the entire body while allowing mobility to the lower appendages. And we can see here the iliofemoral ligament, which is one of the strongest ligaments in the body. It lies on the anterior aspect of the joint, and it prevents excessive hyperextension. The pubofemoral ligament right here, this prevents excess abduction and extension, and it lies anterior inferior. Finally, the ischiofemoral ligament is the weakest of the three and attaches to the ischium and the greater trochanter, which you see here. So this is a ball and socket joint, and it has 3 degrees of movement, which allows 3 degrees of freedom, which allows for 6 movements. These movements are abduction, adduction, flexion, extension, external rotation, internal rotation, and circumduction. And the sagittal plane and axis allows for this flexion and extension. The abduction and abduction occurs in the coronal plane and the frontal axis, and the transverse plane allows for internal and external rotation. So I'm just going to go out here and show you guys these movements. So as you guys can see, abduction moving away from the midline of the body, adduction moving towards the midline. We have flexion and extension, this movement right here going back towards the body. And then we have external rotation, medial rotation, and circumduction, which is the circling of the joint.